Hi, my name is Alex. I'm with the NSNP at Camosun College here. I'm going to be demonstrating a bedside assessment today. I'm going to run through documentation, general survey, your ABCDEs, quick vital sign check, and the assessments that go along with a bedside assessment.
Prior to entering the patient's room, it is important to review the patient's chart, medication administration record, and doctor's orders. The patient's history will often help direct your bedside assessment alongside any issues the patient presents with upon approach. The more information you can gather on your patient before contact helps to provide context to your patient's situation.
Oh.
Jennifer, can I come in?
Yeah.
As I approach, I can immediately tell that the patient is not comfortable. She is guarding, slumped in bed, wincing visibly, and groaning. Immediately, I notice the environment is cluttered with a pillow on the floor at the base of her bed, and her shoes and table in the middle of the room. I can see that she requires glasses to see, yet does not appear to require auditory aids. The patient appears well groomed, and there are no distinguishable odors indicating inadequate hygiene. The patient, despite pain, can acknowledge my presence in the room clearly, without delay, and make eye contact indicating they are alert and orientated, with no immediate, noticeable speech delays. There does not appear to be any mobility aids required, however a pre-standing safety check will provide more information. My first steps will be to help the patient reposition in bed, and then move into my pain assessment in order to increase patient comfort.
You're not looking so comfortable. Let's get you in a new position, okay? Alright, Jen, now that you're a little bit more comfortable, I'm going to ask you a couple questions about that pain, okay?
Okay.
Can you tell me when it started?
It kind of started last night, but it's just getting kind of worse this morning.
Yeah, okay, it started last night.
Yeah.
Sorry about the pain. Can you tell me, like, is there anything that makes it better or worse? Lying on your side or anything like that?
I've just been kind of like lying down, not moving.
Lying down, not moving? Yeah, it's probably a good idea to get some rest, right? Can you tell me about it? Is it dull and achy or is it sharp and stabby? Like,
Yeah, it's just kind of like a dull pain in my stomach.
can you point to it for me?
It's just kind of like over here.
Right over there? Okay.
Yeah.
Have you taken anything for it recently?
I took a Tylenol last night, but not anything this morning.
No? Okay. And on a scale from 1 to 10, 10 being the worst pain you can possibly imagine, where would you kind of set that pain right now?
Just kind of like a 6.
A 6? Does it get better or worse when you get up and down? Or
Not
you mentioned
really.
earlier it alleviates a little bit when you lie down.
No, it's just kind of like it's been just like a 6.
It's just a little more comfortable when you lie down, but the pain kind of stays the same?
Yeah.
Okay. What do you think is causing this pain? Like, when did it kind of start? Where do you think it's coming from?
I haven't been really able to go to the bathroom for the past few days, and it's just kind of been getting worse since then.
And what do you think is going to kind of like make this better and help with it?
I think once I just like am able to go to the bathroom, it'll be better.
Yeah, I think so too. Is there anything I can get you right now for it? Some pain medication that can relieve it, or are you okay if I move on to my next steps?
You can move on. I think that's okay.
Okay. I'm going to move on and grab a set of vitals, okay?
Okay.
Alright, Jen, I'm just going to take a set of vitals here. I know you're in quite a bit of pain, but we'll hopefully get to the bottom of that soon, okay?
Okay.
I'm just going to take a blood pressure, a heart rate, temperature, and an SpO2, okay?
A what?
An SpO2 just helps me to figure out how much oxygen's in your blood.
Okay.
Okay? I'm just bringing the bed up here, okay? Just so I can make eye contact and see you at my level.
Okay.
I'm a tall guy. Alright. Alright. Are you okay if I take the blood pressure on this arm?
Yeah.
Yeah? Okay. I'll hit that up first. There we go. Let me get that going. Get that started. And while I do that, pop that on that arm there. Oh, there we go. I'm just going to take your temperature here on this side. So I'm just going to move your hair out of the way, okay? Alright, perfect. Alright, I'm just going to come over to this side, okay?
Okay.
Just going to grab your pulse on this side. Just going to grab these both wrists, okay? You can relax, it's all good. How's that pain doing?
It's okay. It's still
Still there?
there. Yeah.
Alright, perfect. Let's get you unhooked from that machine, okay? I'm just gonna do a quick abdominal assessment on you, okay? Just to see if I can figure out where that pain's coming from. Alright, Jen, I'm just gonna do a quick assessment here, okay? So I'm gonna start with inspection. So I'm gonna have a quick look, and then I'm gonna listen with my stethoscope, and then I'm gonna feel around and then tap a little bit, okay? I'm just gonna put the head of the bed down a little bit, alright?
Yeah.
Let me know if you're uncomfortable, I can stop, okay? I just need to get you flattened out a little bit so it's easier to look at, okay?
Okay.
How's it going?
Okay, still in pain.
Yeah?
Yeah.
I'm sorry. Alright, I'm gonna put you right there, is that okay?
Yeah.
Alright, so I'm just gonna pull this blanket down a little bit. Can I get you to lift up your gown?
Yeah.
Okay. Alright, perfect. So I'm just gonna have a look here. Can you pull up just a little bit more? That's perfect, okay. Alright. Gonna have a quick listen. Okay. I'm gonna feel for a little bit, okay? Just nice light pressure.
Okay.
And then I'm gonna move around, okay? If it hurts at any point, I'll stop, okay?
Okay.
Just nice and light. How does that feel?
That's okay.
How's that?
That's starting to hurt. Oh, yeah. That,
Right there?
Yeah.
Okay, so I'll try and avoid that as best I can. I'm gonna have to move in there a little bit later on, but I'll try my best, okay?
Okay.
And I'm just gonna go a little bit deeper, okay? Not too much. Just nice and light. We'll avoid that for right now. Just move into it a little bit, okay?
Oh.
I know. I'm just gonna palpate, percuss a little bit, okay? I'm just gonna move in there just a little bit.
Oh.
It's nice and light, okay. Sorry. Alright, you can put that gown down now. Okay, okay. Thank you. Is there anything I can get for you right now? Warm blanket, or do you need pain meds, do you think?
Just a warm blanket.
Just a warm blanket? Okay, I'll be right.
Now that your bedside assessment is complete, it is important to document your assessment findings and vital signs according to your employer policy. Some authorities have transitioned to online charting. Some still use paper charting. It is important to become familiar with your employer policy in order to accurately document and communicate your patient's progress and care needs.
Alright, so now that I've completed a bedside assessment of Jen, I'm just going to run through the basic components of the bedside assessment. The primary components of the bedside assessment are your general survey, your ABCDEs, your vitals, and your priority system assessments. Within your priority system assessments, you're going to want to tailor these assessments towards your patient and their history and admitting diagnosis. For instance, if you have a patient who comes in with an ankle fracture, you're likely going to be focusing on a musculoskeletal assessment. But I just want to note that if you walk into the room expecting an ankle fracture, and during your general survey and ABCDEs, you notice that your patient is in respiratory distress, that now becomes your priority assessment. Tailor your assessments to your patient's needs, your patient's immediate needs over their secondary needs. If you need more information on the primary components of a bedside assessment, please refer to other videos or your Jarvis 3rd edition Canadian textbook.